Hi, my name is Dr. Angela Moreland with the National Crime Victims Research and Treatment Center at the Medical University of South Carolina. Today I'm going to talk about fear that our loved ones may contract COVID-19 or may become ill during this pandemic. So while many people are quarantined during this time and are social distancing from others, are staying away from public places, and are really taking a lot of measures to protect themselves from this illness, the reality is there are a lot of essential workers who are not able to do so during this time. So this can include first responders, medical personnel and nurses, grocery workers, food delivery drivers, and lots of other essential workers who are going out into the environment and into public places on a daily basis in order to help others. So it is important to remember that while we want to acknowledge their safety and we want to make sure that we're staying safe and that they're staying safe during this time, consuming ourselves with fear and worry that they will get sick is not going to be helpful or healthy for us or for our families. Now, that's a lot easier said than done. So, of course, we are going to worry and we are going to have a little bit of increased anxiety around that. But what are some ways that we can help to contain that worry and making sure that it's not completely consuming us? So the first important factor is just to stay informed about the illness. So we want to know what COVID-19 is. We need to know what COVID-19 is, what the symptoms are. How do we prevent spread of the illness? And how do we keep ourselves and our loved ones safe during this time? So we have to watch the media and we have to watch the news at least a little bit in order to understand these things and also to understand what the spread is throughout our country, but more importantly in our own specific communities and looking towards where we are in terms of the pandemic, because it does look differently in different communities across the country. That being said, we also need to limit that media exposure. So while we need to keep informed, watching the media over and over and over again and watching those numbers rise and hearing some of the fear stories on the media are not going to help us during this time. So making sure to really maintain a balance between knowing what's happening and knowing how to prevent it while also not getting consumed by it and not letting that fear completely control us. Also, another major thing is check on your loved ones. So maintaining that social connectedness. Now, we may not be able to do that as much as possible because many essential workers are very busy right now. But if there is any way that we can check on them and keep that communication somewhat open, that can help to give us reassurance and help us to know that they are safe during this time. It's also extremely important to engage in self-care during this time and engage in activities that reduce stress. So stress always increases worry and fear. So if we're feeling stressed and we aren't taking care of ourselves during this time, we are going to be more concerned and we are going to really not be able to handle that concern and worry as much as usual. Another really main factor is just to stay healthy ourselves. So eat well. Get enough sleep, and make sure that we're really limiting stress as much as possible, although it can't completely be eliminated during this time just because of all of the things that are happening. And also prepare for sickness. So make sure that we have, with loved ones going out into the environment and coming back home, making sure that themselves and us and our families have Tylenol. We have all of the things that we would need just in case we do get sick. And although we may not, that will help us to prevent that anxiety and prevent that fear because we will be more prepared if the incident does happen. And then lastly, and very important, is to seek social support during this time. So social support is key to our well-being, both physically and mentally and emotionally. So reach out to other people. Seek support from loved ones in general, from friends, from colleagues, from family members, and also support from people who may be going through a similar situation as yours. Now, much like I said in the past about the media exposure, we do want to limit that if we are reaching out to people who have essential workers as loved ones and they are also fearing and they are also worrying, really balancing that between seeking social support, but not letting the worry and fear of others influence our own feelings. But by maintaining our health and maintaining our stress level and maintaining our support and connectedness with other people, that will help with that a great deal. And just remembering that our essential workers are helping others, and it's really, really special what they're doing, and knowing that as much as we can try to help eliminate some of their own stress and help them to cope better by coping better ourselves, then we're going to be healthier mentally and physically, and we'll keep the health of our loved ones as well through this time.